We've updated the guidelines with the new data from clinical trials that have been published recently in the management of prostate cancer, and to try and adapt these clinical trial data to the elderly population. We've taken into account all the data on the new drugs that are available for patients with prostate cancer at later stages, and we discuss them in the scope of elderly patients with the comorbidity, the risk of polypharmacy, etc., to try and adapt their use to the elderly population. The basis of the recommendations made for treatment for elderly patients with prostate cancer is not based on age, but on their frailty. And the recommendation that has been made by the task force is to use what we had already considered in the previous guidelines, is to use the G8 screening tool to assess for frailty, and the mini-cog to assess for cognitive problems. And with these two tests, we can identify patients that are fit, and that these are patients that have a normal G8 and no cognitive impairment, and they can be probably treated with as younger patients. And patients that have an altered G8 should go for a more thorough geriatric assessment and geriatric interventions. Still not standardized tools to classify these patients, and the prognostic validity of this classification is not certain yet. There's still work going on in that, but it's a practical tool for clinicians, urologists, oncologists, radiotherapists to be able to treat patients in the daily clinic. I think most of the changes were in the management of advanced prostate cancer. There was the results of the Spartan trial and the Prosper trial for non-metastatic castration-resistant prostate cancer that were presented at ASCO GU a year ago, and these two drugs have shown. These two trials have shown that apalutamide and enzalutamide improve metastatic-free survival in the population of high-risk M0 CRPC patients, and we stressed on the potential influence of these drugs in elderly patients. One of the side effects of apalutamide in the trial was falls, and that can be a big concern in elderly patients. And maybe enzalutamide can have some. One of the main side effects of enzalutamide is fatigue, and that also can be of importance in elderly patients. And the other state of disease that is for which the management is really changing currently is for de novo metastatic hormone-sensitive prostate cancer, with data on docetaxel in that space, with the charted trial that was updated, the Stampede trial in that population, and different meta-analyses on the different trials that were done in that population. We have data now on abiraterone in that population, with the Latitude trial and the Stampede arm of with the abiraterone arm of the Stampede trial, and since the guidelines were published, there's been data on enzalutamide too in that setting. So it's a changing setting in the whole population of de novo metastatic hormone-sensitive prostate cancer, and the question is how to adapt these changes to the elderly patients. And there's also new techniques that have been brought into the management of prostate cancer in the radiotherapy field, and that is addressed too in the guidelines. There's several difficulties in lower and middle income resource countries, and that's the access to drugs, the access to radiotherapy, the access to geriatricians and to oncologists, and so we have to do more research on that and to implement these changes into low and medium resource countries. There's need to continue the collaboration between geriatricians and oncologists and urologists to offer the optimal care for elderly patients with prostate cancer. There's also need for more research on new drugs for patients with metastatic castration-resistant prostate cancer. That's true for younger patients, but also for older patients, and to have clinical trials that address the problems specifically in elderly patients is important too. And probably there's a need for more research and management of local prostate cancer too, and which is the best decision for elderly patients with prostate cancer.